Superbugs are a super threat to humanity. In fact, scientists predict that by 2050, millions of people will die from superbugs every single year. So here's the national data for what we're experiencing right now. According to the CDC, 2 million people suffer from antibiotic-resistant infections every single year. 23,000 of those people actually die. It's a small piece of the pie right now, but doctors fear it could get even worse. In fact, this is how antibiotic-resistant works. First of all, there are a lot of germs in our bodies. Few are drug resistant. But then we get sick and then antibiotics are given and it kills the bacteria causing the illness. But it also kills the good bacteria as well. That leaves room for the drug resistant bacteria to grow and take over. And the bottom line is this bacteria doesn't discriminate.
This isn't a rich country problem and it is not a poor country problem. This is a problem we're seeing in all settings.
Dr. John Lynch, medical director for infection prevention at UW-Medicine's Harborview, says all across the world, doctors are seeing a terrifying increase of superbug bacterial infections.
We have seen these cases here in Seattle. We've been fortunate in most cases to be able to treat these folks and treat them successfully, but it has often been an enormous struggle, especially for the patients. I need to treat these individuals with toxic medications, multiple medications, things like additional surgeries that would otherwise not be necessary to get them cured.
Doctors like infectious disease specialist Yevgeny Sukurenko are now struggling to figure out where the superbugs are coming from.
It could be healthy people, it could be animals, it could be our pets. It's because of the spread, such a spread use of antibiotics, high use, they're becoming in our rivers, and it's breeding superbugs in the rivers and in our soil.
Nonprofit biotech group known as Armada, short for Antibiotic Resistance Monitoring, Analysis and Diagnostics Alliance, are working to collect superbugs from all over the world to begin identifying and cataloging them, to create a database that will help doctors prescribe the right antibiotics quickly.
After we have the bugs in our hands, samples, we do it within hours. We can determine fingerprints within actually less than 1 hour.
Treating the illness with the correct medication is paramount, not only for getting the illness under control, but to stop bacteria from evolving into antibiotic-resistant superbugs.
Projections are that within 1-2 generations, more people will be dying from the drug-resistant bacteria than from cancer and diabetes combined.
For HealthLink, I'm Amity Addrisi.